COVID-19, the problem is lack of oxygen availability to the human body. That can happen because of two things. One, pneumonia. Two, the fibrosis of the lung tissues. This is where oxygen plays a part. Now, we know that for this, we need a supplement of oxygen. This is the typical oxygen cylinder. And there are some attachments. This is the oxygen regulatory kit, and this is the oxygen mask. Now in this video, I'm going to tell you how you can use these three things and supplement the oxygen in your body. Okay, these are the parts of the oxygen regulatory system. This is the pressure gauge that measures the pressure of the oxygen in the cylinder. This is the actual regulator, and this is the humidifier, and this is the flow meter. So this can measure what is the pressure of the oxygen in the cylinder. This humidifier contains water, which causes the dry oxygen to be a little more moist when it enters the patient's body. And this gives you the actual level of oxygen that is going into the patient's lungs. I'll demonstrate to you how you can attach this regulatory mechanism to the oxygen cylinder. So here there is an inlet that has to go into this orifice. Now I tighten it by using a bolt here. Once we tighten it, the regulatory mechanism now is firmly attached to the oxygen cylinder, and primary concern is there should not be any leak of the oxygen. For that, we get a spanner along with the kit, just tighten it for a bit, and then we're ready to go. And now finally, we attach the oxygen mask to the outlet of this regulatory device. Now this is the total connections. Now this oxygen, I'll show you in a while, is delivered in the mask to the patient's face. Now that the full system is connected, we have to ensure delivery of the oxygen from the tank to this device. For that, there is another lock that is on top of the oxygen cylinder that you can unlock with this particular key that is provided with the kit. What you do is unlock it for a little time and then adjust the regulator, and you can see the oxygen coming. Now the oxygen comes through this part, rushes through the water, thereby giving humidity to that dry oxygen, and here you can see the actual flow of oxygen. If you increase it, the flow increases, and the flow is better, and this is delivered through the mask, this cloth for the patient's face. Like this is how to successfully install and deliver oxygen to any patient. Let us tackle some practical tips and tricks. Now, if you don't have sterile water with you, what you can do is you can use the water from your home water filter system, or you can use a mineral water that is commercially available, or in a worst scenario, you can use boiled water that is cooled down, and then that water will be good enough to humidify the oxygen. The other thing to remember is, you cannot determine by yourself how much flow of oxygen the patient should have. That a doctor should tell you. Ideally, the range is from 1 liter per hour to 6 liters, and the doctor will give you exact based on the patient's current oxygen level. Now, we measure the pulse oximetry oxygen level in the room conditions. Anything less than 92% has to be supplemented with oxygen. That is the criteria in COVID-19 patients. Oxygen can thus be delivered safely and save many lives.